Welcome to Health Library. Today, we are going to discuss an important issue related to brain health. The brain is one of the most important and complex organs of our body, and various symptoms can occur when it is damaged. By watching this video, we will discover the unexpected and strange symptoms of brain injury. From speech disorders to forgetfulness and concentration difficulties, we will take an in-depth look at the changes in brain health. In addition, we will also learn about the causes of these symptoms and treatment options. You will learn about the importance of maintaining your brain health and recognizing early symptoms. Now, let's start exploring this important topic about brain health together. A headache or migraine is a common symptom that affects everyday life. Headaches can be of different types. Tension-type headaches are usually characterized by a feeling of tightness on both sides or around the head, and are associated with factors such as stress, poor posture, or November muscle tension. On the other hand, migraine is a more severe and often unilateral headache. It can also be accompanied by hypersensitivity to light, sound, or smells, nausea, and even certain symptoms called aura. Migraines are associated with a genetic predisposition and can be associated with triggers such as hormonal changes, environmental factors, or certain foods. Treatment usually includes methods such as medications, lifestyle changes, and avoidance of triggers, but it is important to consult a healthcare professional for severe or frequently recurring headaches. Specialists will assess the patient's symptoms and medical history to make the correct diagnosis and determine the appropriate treatment plan. Memory loss or difficulty concentrating are important issues that are directly related to brain health. Memory problems can often manifest themselves in the form of forgetfulness, difficulty remembering information, or difficulty learning new information, which can affect the ability to remember and store important information for a long time in everyday life. Difficulty concentrating, on the other hand, can occur as distraction, difficulty focusing, and difficulty completing tasks, which can negatively affect work or school performance. These symptoms can often increase with age, and there may be underlying medical or psychological factors. Therefore, it is important that individuals experiencing such problems receive appropriate evaluation and treatment in consultation with a healthcare professional. Specialists will try to make the correct diagnosis by evaluating the symptoms and will create a treatment plan through various methods such as medications, cognitive therapies, lifestyle changes, and mental health support. Slow or abnormal speech can indicate some important problems that are usually associated with brain health. A significant slowdown in the speed of speech can be a sign of language and speech disorders or neurological problems. These conditions can often be associated with conditions such as brain injury, stroke, brain tumors, neurological diseases, for example, Parkinson's disease or multiple sclerosis. Dementia, abnormal speech patterns or changes in tone of voice may be due to speech November, affected speech muscles, or language and voice disorders. Also, speech problems that start suddenly or worsen progressively can be a sign of a serious impairment in brain function. It is important for people with such symptoms to consult a healthcare professional because early detection and appropriate treatment can prevent the progression of possible neurological problems or alleviate symptoms. Specialists will perform appropriate tests by evaluating the patient's speech problems and determine the underlying cause and create a treatment plan. Loss of balance or difficulty coordinating can often be a symptom of many different health problems. Difficulty maintaining balance while standing or walking can be associated with conditions such as inner ear problems, neurological disorders, for example, stroke, brain trauma, multiple sclerosis, inner ear infections, or vertigo. Coordination difficulties, on the other hand, can usually manifest themselves as difficulty in hand and arm movements, difficulty holding or using objects, and can be associated with various factors such as neurological problems, November muscle weakness, rheumatic diseases, or brain damage. It is important for people with symptoms of balance loss and coordination difficulties to consult a healthcare professional because early detection and treatment can prevent possible serious complications or stop the progression of symptoms. Specialists will perform appropriate tests by evaluating the patient's symptoms and determine the underlying cause and create the appropriate treatment plan. Sudden emotional changes or mood swings are symptoms that are usually directly associated with mental and emotional health. For example, sudden outbursts of anger, extreme unhappiness, excessive joy, or emotional ups and downs often appear as symptoms of mood swings. Such emotional changes can be associated with psychological or psychiatric conditions, such as bipolar disorder, depression, anxiety, stress, or post-traumatic stress disorder. In bipolar disorder, rapid transitions between manic, overly cheerful, and decadent, extremely sad, periods may occur, while in depression, symptoms such as feeling constantly sad, feelings of worthlessness, hopelessness, and loss of energy may occur. It is important that individuals who experience sudden emotional changes or mood swings receive the correct diagnosis and appropriate treatment in consultation with a mental health professional. Sleep problems are a common problem that usually negatively affects people's daily lives. There are various sleep problems, such as insomnia, sleep apnea, difficulties falling asleep or staying asleep, irregular sleep rhythm, or sleep disorders. Insomnia is often associated with factors such as stress, anxiety, depression, physical ailments, or poor sleep habits, and it can prevent a person from resting or doing daily activities. Sleep apnea is manifested by symptoms such as snoring, respiratory arrest, and difficulty breathing during sleep, and usually reduces the quality of sleep and can cause a feeling of fatigue during the day. Sleep problems can often be a sign of underlying medical or psychological conditions and can negatively affect the quality of life of individuals. Therefore, it is important that people experiencing sleep problems consult a healthcare professional and receive the appropriate diagnosis and treatment. Brain injuries are serious health problems that usually occur for traumatic or non-traumatic reasons, and they can cause a variety of symptoms. Traumatic brain injuries can occur as a result of events such as head impacts, car accidents, falls, or sports injuries. Such injuries can cause damage to brain tissue and lead to various physical, mental, and emotional problems. For example, there may be speech disorders, difficulty finding words, difficulties understanding or expressing sentences. Memory loss is also a common symptom, and both short-term and long-term memory are affected, which can affect daily living activities and functionality. Difficulties in motor skills may also occur. For example, symptoms such as lack of coordination, balance problems, or November muscle weakness may occur. Neurological disorders are health problems that have negative effects on the nervous system and lead to various symptoms. Epilepsy is a condition in which seizures occur due to abnormal electrical activity in the brain. These seizures may manifest themselves with symptoms such as loss of consciousness, November muscle twitches or unconscious movements. Migraine is characterized by symptoms such as severe headaches, sensitivity to light and sound, nausea and vomiting. Multiple sclerosis, MS, is a disease that causes damage to nerve fibers as a result of the immune system attacking the body's own tissues. This condition can occur with symptoms such as fatigue, November muscle weakness, balance problems, and loss of sensation. Amyotrophic lateral sclerosis, ALS, is characterized by the loss of motor neurons over time and muscle weakness. NOV, amyotrophic lateral sclerosis, ALS. This disease is progressive and can affect basic functions such as breathing and swallowing over time. Parkinson's disease is a progressive neurological disease associated with a decrease in dopamine production and leads to movement disorders, tremors, November stiffness, and balance problems. This disease usually begins in middle age and later, and symptoms usually increase with age. Symptoms of Parkinson's disease include tremors in the hands and arms, decelerating movements, bradykinesia, November stiffness, rigidity, balance and coordination problems, postural disorders and walking difficulties, akinesia. These symptoms usually affect the patient's daily life and reduce his functionality. However, Parkinson's disease has a progressive nature, and over time the symptoms increase, making daily activities even more difficult and negatively affecting the quality of life. Treatment usually focuses on managing the symptoms and aims to correct the dopamine deficiency. Schizophrenia is a psychiatric disorder that is directly associated with brain health and causes complex symptoms. Chemical imbalances in the brain and problems in nerve conduction may play a role in this disease. In particular, changes in neurotransmitters such as dopamine, serotonin, and glutamate can be effective in the appearance of schizophrenia symptoms. Dopamine imbalances are especially associated with hallucinations and thought disorders, while changes in serotonin levels can lead to mood disorders and behavioral problems. In addition, structural and functional changes in the brain are also associated with schizophrenia. For example, brain imaging studies have revealed abnormalities in areas such as the hippocampus and prefrontal cortex in people with schizophrenia. If you like the video, don't forget to like it. Subscribe for more such content. Wishing you a healthy day. See you in the next video.